Advocates for the nursing profession held their week on the Hill this week, as that profession, like so many others, is struggling to cope with the workforce shortage and other challenges that have been exacerbated by the pandemic. Joining me to talk about ways to improve the lives of Minnesota's healthcare workers is Senator Erin Murphy. Thank you for being here.
Thank you for having me.
I'd like to begin with the frontline worker bonuses, the $250 million that the legislature set aside to reward people who continue to show up for work in the early days of the pandemic. An agreement on that $250 million was never reached, but on the Senate floor this week, you proposed an amendment that would give each of those workers $1,500 in bonus pay, which by my calculations then comes to almost $1 billion instead of the $250 million. What's your thinking on this?
So the frontline workers did so much for us, especially at the start of the pandemic, and they continue to keep us healthy and alive, more importantly to keep our economy moving. The surplus that we're enjoying now is in large part because of their contributions at the start that bolstered our economy. And we're in a really strong position now. We made a commitment to them at the end of last session, and it's unconscionable, really, and heartless to make them wait. That's why I brought the amendment yesterday. I believe every one of those frontline workers deserves a check, a bonus pay of $1,500, and frankly, we can afford it. And when you think about the issue of inflation caused by this pandemic, and those frontline workers who are largely low-wage workers dealing with increased costs of groceries, of gas, of everyday expenses, a $1,500 check will go a long way. We should put that money right into the pockets of Minnesotans. It will help them. It's a nod to what they did for us. It'll be good for our economy.
People following the legislature may notice that there are parallel tracks between law enforcement support provisions that are being proposed by Republicans and nursing support provisions that are being proposed by DFLers. Both groups say there's a need for student loan forgiveness, for mental health support, and for help recruiting more people to these professions. Are there parallels in the challenges facing both law enforcement and nurses?
You know, the pandemic has really disrupted our lives, all of our lives, in so many ways. And we're seeing a real impact on critical sector employment, like law enforcement, like nursing, like educators. And I think it is our obligation as policymakers to tend to that. I'm not one bit surprised that we're seeing parallel proposals in terms of recruiting and pipeline and wage increases and mental health support for educators, for nurses, for law enforcement. I like to remind people that where we are seeing worker shortages, it really is a function of wages. And we should not only pay attention to the pipeline, but to retention. And part of retaining a skilled, critical industry workforce is paying attention to their wages, and we need to do that.
Let's focus a little bit more on nursing. You were the chief author in the Senate of a bill that's called the Keeping Nurses at the Bedside Act. There was a staffing shortage in nursing before the pandemic, but like so many other sectors, it has been significantly worsened. What are the underlying causes of a staffing shortage in nursing?
We've experienced shortages across the country for many years now, and in Minnesota, nurses have been calling that to our attention, wanting us to intervene to improve the way the hospitals are staffing. You don't go to the hospital and not get your care from a nurse. They're integral. And we also know, and the data is really clear, that adequate staffing means excellent patient care. So when nurses are talking about making sure there are enough nurses at the bedside, it is because they want to make sure they are providing excellent care. If you listen to nurses right now, the duration of the pandemic has really done a lot of damage to the well-being of our nurses. And they talk a lot about a moral injury, having to provide over this critical time unending care for people who are very critically ill, many of them dying. That's why they're talking about needing more peer-to-peer mental health support, and that's why they're calling the question on staffing. Because if we want to retain our nurses, we have to change the conditions under which they're working. We need to make sure that there is adequate nursing to care and give excellent care to Minnesotans who are seeking care in our hospitals.
This is a very comprehensive bill. It tackles mental health, loan forgiveness, recruitment, as we've already been talking about. But it will also require each hospital to form a committee of both nurses and management to set staffing limits. Why is this important?
You know, this is such an important shift coming from the nurses, who for years have said we need, you know, to set a statewide number of nurses caring for a statewide number of patients. And it's been hard to move that in the legislature. So they have shifted in significantly to say at every hospital, because our hospitals are different. Abbott Northwestern is different from Hennepin County, and that's different from the hospital in Staples. But let's put the nurses together with the administration and come up with an annual plan to assure there are enough nurses caring for the patients there. Those nurses are experts in providing care. They want to do it in partnership with the hospital administration, and from my perspective, this is a very, very strong proposal that should be supported by the hospitals. It is supported by the nurses because together, right, nurses and hospitals together are going to be the solution, or the path to the solution of making sure that Minnesotans are getting excellent care.
The bill would also require that the Minnesota Department of Health conduct surveys on staffing retention, the environment of the workplace, and quality of care. And frankly, I'm surprised that something like this doesn't already exist when you consider how integral nursing is to healthcare. Why has this not happened before, and how would this potentially change the landscape?
I agree with you that it is long overdue, and surprising that it's not there, because the care by nurses is so integral to the quality of an outcome for somebody. Many years ago, I worked with the hospitals and a stakeholder group, including the Department of Health, to come up with an adverse events policy, a list of things that should never happen. And even then, nurses were talking about wanting to include staffing in that mix, and the hospitals blocked that. I'm not quite sure why the hospitals are so resistant to making sure that there are an adequate number of nurses. But I do think it's time for us to gather the data so that we are sure, that we're confident that the well-being of the patients inside the hospitals are front and center for all of us, and that the issues that the nurses are raising are being tended to, but not just because they're raising them, but because we have really strong data coming from the Department of Health.
As you know, Governor Walz has mobilized the National Guard to help staff hospitals in some areas. He also used federal dollars to provide free certified nursing assistant education, or CNAs, to a new pipeline of workers. These are BandAids. So is the Keeping Nurses at the Bedside Act enough, or is it just a start?
I think the effort to retain our nurses at the bedside is critical. We know we need to do it. It was a problem before the pandemic, and the pandemic has just illuminated for us the problem with just enough staff, which is the model that the hospitals have been using. We'll have just enough, and if something shifts, we get more patients, a critical patient, something happens in the hospital, the nurses are in a position where they don't have enough nursing staff to do their jobs and do them well. That's not right. I am grateful for the National Guard, and I hope some of them who are working in our hospitals right now choose to make nursing their career. They're getting a really, really important experience. We'd love to have them within the ranks of nursing. I also think that the investment in CNAs and training right now is an important measure to make sure that we're getting through the pandemic. But those two things alone are not enough. And I think that the effort to retain nurses and to answer to the concerns that nurses have been raising for more than a decade, that is our path forward to make sure that we're always providing excellent patient care in our hospitals here in Minnesota.
One last thing, you mentioned the just enough staffing, and that brings up the issue of traveling nurses who have been used quite a lot in the pandemic. The wages for a traveling nurse are significantly higher than those of a nurse who lives and works in the area. Presumably that increases the cost of healthcare. What is your view on the traveling nurse situation, and should it be utilized more or less, or what do you think?
So for all of my career in nursing, there has always been a role for traveling nurses when, you know, there's a crisis, when there's a problem and we need extra hands. You know, there are nurses that I even looked into going to New York at the start of the pandemic, to be honest with you, because I knew I had something to offer. So there's a role for us to be able to move, and the licensure schemes in every state allow for that. Right now, I think that why the traveling nurses are being paid so much is because we're at the epicenter of a crisis. those dollars would be much better utilized in keeping nurses at the bedside here in the state of Minnesota. And I hope we move in that direction, and we move in that direction this session.
Senator Erin Murphy, it's always a pleasure. Thank you.
Thank you very much.